We're going to go ahead and get started. I apologize for being a couple minutes late. It's my fault. So we'll get started here. I have to read some statements as part of the National Academy SE&M's policy. So let me just do that. My name's Jim Weinstein. I'm chair of this committee. And as chair of this study, I would like to welcome everyone to the third meeting of the committee on community-based solutions to promote health equity in the United States of the National Academies of Science, Engineering, and Medicine. This project is sponsored gratefully by the Robert Wood Johnson Foundation. I'm joined by the committee members who are sitting in the first couple rows here who are, and ask them to introduce themselves in just a few minutes. This is the third information gathering meeting of the committee. The committee's fourth meeting will take place on July 27th. In addition to the presentations we will hear today, the committee has reviewed information relevant to the charge and will continue to gather additional information over the course of this study. Speakers' comments will be followed by a question and answer period, primarily focused on clarification of fact by committee members. Hoping time will allow, we will open the floor to meeting attendees to ask questions. At the end of the day, we will have a period of public comment, and audience members will be able to make brief comments. For the record, speakers will be asked to disclose whether they receive any funding for activities related to the topics being discussed today, and the sources of such funding, for example, government agency or foundation funding. This is an open information gathering session, which means that the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it will be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the National Academies. In addition, committee members typically ask probing questions in their information gathering sessions, which may not be indicative of their personal views. The committee's report is expected to be released in December of this year, 2016. The committee will deliberate thoroughly before writing its report. Once a draft report is written, it must go through a rigorous review by external experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the National Academy's Report Review Committee and the chair of the National Research Council before the report is considered an NRC report. For information on this study, you can visit the project website available in your attendee packets. If you have any logistical questions, as the day moves on, please talk to our staff at the registration table and around the room. This meeting is being webcast live and recorded. Available speaker presentations and videos will be posted to the project website 1 to 2 weeks after the meeting. We now will go around the tables and have the committee members introduce themselves, giving their names, current affiliations. 4 committee members, Ned Calange, Robert Duger, Helene Gale, and Julie Monta, could not join us today. Brief bios of the committee members and speakers are available in your meeting packets. I would now like to introduce our panel. We will hold questions and answers after both our esteemed panelists have presented. First, we will hear from Doran Schrantz, Executive Director of Isaiah. Then we will hear from Nina Wallenstein, Director of University of New Mexico Center for Participatory Research. I'll start as a panel member. I'm Jim Weinstein, Chair of the Committee. I'm CEO and President of the Dartmouth-Hitchcock Health System. Bashir?
Bashar Shukair. I serve as the Senior Vice President for Safety Net and Community Health at Trinity Health.
Andrew Grant Thomas. I am the co-developer of a new initiative called Embrace Race.
Dr. Elizabeth Baca, the Senior Health Advisor in the Governor's Office of Planning and Research for the State of California.
Hortensia Amaro, Professor at the University of Southern California School of Social Work and Department of Preventive Medicine, and Associate Vice Provost.
Kent McGuire, CEO of the Southern Education Foundation.
Christopher Lyons from the University of New Mexico, Department of Sociology and Criminology.
Chandra Ford, Associate Professor of Community Health Sciences at UCLA.
Nick Tilson, member of the Oglala Lakota Nation and Executive Director of the Thunder Valley Community Development Corporation.
Hi, I'm Lee Shore. I'm a senior fellow at the Center for the Study of Social Policy.
Tia Powell, Director of the Center for Bioethics at Montefiore and Einstein, and a professor at Albert Einstein College of Medicine.
Bill Wyman, independent consultant, experience in the delivery of healthcare.
Sister Carol Keehan, President and CEO of the Catholic Health Association of the United States.
Allison Cuellar, I'm a professor at George Mason University.
Robert, could we get you?
Robert Garcia, I'm a civil rights and human rights attorney with the City Project based in Los Angeles, California, and I'm happy to be here.
And we're happy you're here. So first, let me introduce Darn more formally as our first speaker. As Executive Director, as I said, of Isaiah, a faith-based community organization of 100-member congregations in the Twin Cities area in Minnesota. Ms. Grants has been at the center of Isaiah's development from a small, more local-focused community organization of 64 member institutions to an organization considered one of the most powerful voices in the state around issues of racial and economic justice. She has launched a powerful partnership with Nassar research and policy leaders such as PolicyLink and Professor John Powell of the Kirwan Institute. Welcome, Doran.